All right, perfect. I hope everybody had a wonderful Valentine's Day. Um, in light of our Valentine's Day, this seminar is about finding the perfect pout. Today we're going to go over, there's going to be an amazing giveaway for all of our attendees here, and then you'll be able to meet us as well as a little bit about the Revive team, why lips matter so much in facial aesthetics, as well as how our lips age. Man, everything ages. Okay. All about lip filler, about lip flips. We're actually going to have a live demo treatment today with one of our models and question and answers along the way. Please, please, please go ahead and put them in the chat and I will answer them as we go as well. We have a ton of social media information, how to follow us. All of our Instagrams will let you know after, as well as a special offer. So please stay tuned till the end. All right, this beautiful young lady to my right here is one of our PAs, Shannon. Shannon, can you tell us a little bit about yourself?
Hi, so I've been at Revive for coming on my year anniversary, but I've been in aesthetics for about 22 years now. I have a pretty broad experience in all kinds of things as aesthetics, from lasers to injectables. But I think my passion really is the liquid facelift, facial balancing, and have a special interest in regenerative aesthetics as well.
Love it. Shannon's actually done some treatments for me too, and she's wonderful. So definitely come see her if you're close to our Mission Valley location. And hi, everybody, that's me. I'm Julie Norton. I'm one of the VPs here at Revive. I've been in aesthetics for over 13 years. I started as a licensed cosmetologist and I did hair. I still do hair, especially for some friends and friends' children. And I've been in the beauty industry for over 20 years, and I'm an aesthetics expert here at Revive for over two. It's been a really fun, wild ride, and I think people always ask when they're new to aesthetics kind of where to start. And I'm a very much an and person than an or person. So to kind of start somewhere, ask your provider, and all the providers here at Revive are wonderful. So a little bit about us here at Revive Med Spas. We've actually been around since 2006, which is 20 years. We're going to have our 20-year anniversary next month. Stay tuned. If you're on our emails, if you're a Radiance member, then you're going to get all the exclusive event deals as well as all the information on where we're going to be hosting and which locations. We are the number one provider for Botox, Juvederm, Voluma, Cool Sculpting, and number one in Morpheus 8 in California. We have 8 locations, 5 here in Southern California, and then we have 3 in our Northern California locations. To your right, you see our East Lake location, which is one of our newest locations. It is absolutely gorgeous. That is exactly what it looks like. We have wonderful providers there in our East Lake location as well. Here is our medical team or our medical board. Dr. Vishal Verma, he's been there since the beginning. He's our co-founder and our medical director. And then Dr. Megan Naud. We are really dedicated here to identifying suitable non or semi-invasive options for each unique concern or each patient. We also, for our providers, we always offer amazing advanced training opportunities for all of our medical providers. So they also have access to the latest technologies and the latest techniques. All right, into the good stuff now. So Shannon's going to help me through all of this because I myself don't know the ins and outs, and I'm sure a lot of our viewers don't. But why do lips matter so much in facial aesthetics?
They just create balance to the face. If we have, as we age, the lip nose distance tends to lengthen and drop. Maybe you have downturned corners, making the face look sad, or even just simple wrinkles in the lips, looking dehydrated. So restoring these little factors really can make a difference to the whole look of the patient.
Love that. Okay, so as I was saying, everything ages, which is just extremely unfortunate. And how lips change with age, what does that look like?
We just went over that. So
Hmm.
you start to get a lengthening between the nose and the top of the lip border, sort of losing the shape. They may flatten down, become more wrinkled and dehydrated. Corners turn sad. And so, just like I said, restoring all of that really just brings more balance and youth to the face.
Hmm.
Sometimes it's even just the nasolabial folds or down by the chin starts to lose bone. You can lose fat in the face. So restoring these areas can help to support the lip, and maybe you don't even need a lip filler.
Hmm.
So it really comes down to a personal assessment of each person.
Yeah, so it's not just about lips, it's about
The
everything
big
else.
picture, yeah.
And I just turned 40, and I definitely could tell in the last few years that my lips were getting more dry and having more lines in them. And so this last time that I had done some lip filler, it really helped to hydrate, and that's kind of what my provider was really focusing on was more hydration. And I've even seen like people get like lip lifts, for surgically
Mhm.
because as you were saying, it starts to drop and lengthen in this area. But yeah, we have some amazing before and after photos too of patients that have done not just lip filler, but just facial balancing. Okay, what is a lip filler?
Lip filler is hyaluronic acid. Hyaluronic acid is normally in our skin. It's most abundant when we are babies. That's why we're all plump and juicy then. But it starts to really break down and deteriorate over time. Nowadays, there are a ton of hyaluronic acid choices,
Mhm.
various different brands, and each brand has their different styles based on how plump they are, how much stretch they might have. Some are just really for support of wrinkles or like defining borders. So we really have a lot of things to choose from. So again, it does come down to like personal assessment and what each patient needs.
Yeah, so not all filler is created equal.
No,
No.
no.
Okay, who is a candidate for lip filler?
Gosh, some people do it for funsies. They just want a little enhancement, uh, just to plump the lips up. But anyone who wants to see some fullness or maybe gain some definition to their borders, um, natural thin lips or having those wrinkly, they just want
Mhm.
some hydration. And then obviously somebody who wants results that might last a little bit longer than a lip flip.
All right, I think this is a big question because as we were talking about, not all fillers are the same, but how long does a typical HA filler last or a lip filler last?
The generic answer is it depends on a lot of things. Could be 6 months, it could be 2 years, could be even longer than that. It comes down to the person's metabolism is probably the biggest one.
Mhm.
Also the type of product that we're using, how much of the product that we use. So there's a lot of factors with that, but generally it does get you, several months of result with it.
Hmm. And we'll talk a little bit more about this later because sometimes filler can sometimes move too, so it's not
Mhm.
really fully gone. All right, we're gonna look at some awesome before and afters. So, I mean, I see a huge difference, especially in that upper lip. But Shannon, like, what do you see?
I see a little bit of asymmetry first. One side's a little bit higher than the other. Definitely starting to see some dehydration, some wrinkling in the lips, some flattening of them as well. I even see a little bit of shadowing in the marionettes,
Hmm.
a little bit of nasal labial folds there as well.
Hmm.
So looks like we need a little bit of restoration around.
Hmm.
I think this patient just addressed her lips. That's all she wanted to do.
Hmm. Looks good though. And that's just a single syringe. All right. So I know we talked just briefly about kind of facial balancing and certain things, but this patient obviously did more than just her lips. But can you walk us through that before and after?
So this patient had several treatments of lip filler in the past, and she's a little bit overfilled. Never really talked much about dissolving, but in this instance, she had to go through several sessions of dissolving just to kind of get back to baseline so we can see what we were working with. And then for her, we not only did a little bit in the lip, but we also had to address some chin that
Mhm.
really kind of helped support support her lip and bring back more natural balance.
Hmm. Yeah, it looks wonderful, but it's also very natural, like from
Yeah,
the left to the right
yeah.
before to after. Okay, what is a lip flip? A lot of people call in asking about this. I know our client services team gets this a lot, but what is a lip flip?
Very different from a filler. Lip flip is usually using a neuromodular such as Botox. There's a lot of those on the market, so we can kind of choose for each patient what might fit them best. But tiny units of Botox applied to the upper lip to affect the muscle, and the muscle will help it pop out or flip the lip outward. So you get to see a little bit more of the pink of the lip without adding any volume to it. So it's kind of a illusion of more volume.
Love it. Quick
Yeah.
trick.
Little trick. Doesn't
And
last as long either. It usually lasts you anywhere from 1 to 2 months, depending on how many units we apply.
and does that have a lot to do too with how much we move our mouth?
It will affect the lip wrinkles, the smoker lines,
Hmm.
as well. So it'll not only make the lip appear bigger, but it also help to smooth any of those wrinkles that are up top as well.
Love it.
Uh,
So who's a candidate for a lip flip?
the biggest one will be someone who has like their lip that sort of curls under,
Mhm.
or just no upper lip at all, sort of disappears. Using a neuromodulator for that reason will actually give a little bit of that lip back. Sometimes people are afraid of fillers. They don't want to go. They want baby steps into the whole
Mhm.
process, and they just want to dabble in the area, and we can kind of give them that baby step entry level, so to speak, with a lip flip. So
Mhm. Less of a commitment.
less commitment.
All right, here's some really good before and after photos of a lip flip. This is 8 units for a lip flip.
Yeah, so this patient's upper lip sort of disappears. It kind of curls in. So applying the 8 units to the upper lip, four on each side, kind of help that relax and show a little bit more of the pink there for her.
It's very nice. And then here's another one of a syringe of lips and adding a little bit of a lip flip.
So this patient had, yes, she wanted to restore a little bit of volume. She just wanted to have him a little bit fuller. But she has some of that tucking under of the lip when she smiles, and also what they call a gummy smile, where you show a mark of gum above your teeth. So they're a little bit different locations, but one, like the lip flip, will pop the lip out a little bit, and then the gummy smile is up near the nose, on the sides of the nose, and it affects a muscle that helps to sort of drop that lower lip down, or I'm sorry, upper lip down,
Mhm.
so that we don't see as much gum when we smile.
Love it. Looks really nice and it still looks very natural.
Mhm.
Okay, we are already going to start. I don't see any questions in the chat yet, so we can ask as we're going as well, but Shannon's going to get started on our patient. We have a lucky patient today. It is her birthday, so she's going to get a little lip flip with her birthday. This is our model, and you go ahead and give her a happy birthday in the chat. Um, but I'll let Shannon kind of go over how she consults with the patient because as we've talked about, there's lots of different fillers, like how do we choose the right one? And then, patient's needs as well.
All right. So birthday girl Brooke. She has had her lips done before, but she's always been pretty conservative, maybe half syringe, and not very frequently. I think you mentioned it was like several years ago since you've had your last one done. Um, so for Brooke, she has really pretty lips. We're just seeing a little bit of flattening. There's kind of not a lot of belly to the lip, and then we have some dehydration, or some wrinkling going on. She pointed out that she likes the sort of line in the center that gives her two little pout, like ball pouts on the side. So she would like to keep that and not have one continuous lower lip. So we're gonna just try to keep her lips the way they are, but just give her a little bit of restoration. How do you feel? Yes.
Nice enough.
Yeah.
Yeah, so comfortability wise, I'm sure that's one thing we haven't really gone over. What are some things that we do to make sure our patients are comfortable?
So we apply a strong topical anesthetic. Makes the area pretty numb. Some folks may use some ice, some folks can use a cold spray. Just kind of depends on the individual. Some people even do a gentle block. So we have a lot of different options of things that people can do. We decided to choose a product that's not only going to give some hydration for her, but something that will kind of give a little bit of projection so we can have some like rounded look to the lip as well. So are we ready?
Mhm.
Let's go.
And there's a few questions coming in as we go. Um, it says, what kind of lip fillers does Revive have? This will long.
All of them. We have all of the Juvederm line, the Juvederm regular, Juvederm Plus, Volbella, plus some of the other ones that maybe not necessarily for lips. We have the Restylane line ones with regular Restylane, Restylane Kiss. We have RHA products from Redensity, RH2, 3, and 4. We also have Reviness, which is a Versa or their Lips Plus. Um, and I think that's it. We have a lot of other fillers too, but not all for the lips. So, right.
All right, cool.
Well, let's go. We're gonna start here so we keep the numbing little poke. Doing good. Barely feel that. Give a little pinch.
So it looks like some of the chat is not working. So if you guys have questions, you can go ahead and plug it into the Q&A. It says, yeah, they had questions on how long a lip flip lasts, which I know we did go over that, but we can go over it again as well.
Yeah, a lip flip gets you anywhere for 1 to 2 months. Because we're using such tiny amounts, we don't want to completely paralyze the mouth. That can definitely make things a little difficult. So little baby amounts to make little baby results. And then as things wear off, you can come in either more frequently or you could just wait till your next Botox is needed. Say like if you're doing your forehead or crow's feet or something, we could do them all together.
Easy peasy.
Mm,
How are you feeling, Brooke?
Great, that numbing cream is the best.
Fantastic.
I don't even feel it.
That's that.
All right, a few other questions. My lip is starting to drop from my nose, like you had mentioned. Am I still a candidate for filler?
Would have to take a look first of all, right? But it does sound like you can use filler to sort of lift the Cupid's bow. I know we mentioned some people do surgery for that, but there's a lot of things that you could do with filler with the right injector to be able to make things look better without surgery.
Okay, so, short answer, Jessica, yes.
Yes.
But I think it's always best to come in and we offer complimentary consultations with our providers. A lot of times you can do treatment that day, depending on, how long the consultation is. But, many times it could be probably a mixture of filler, it could be a mixture of a lip flip. But yes, of course, we're here to help. And then I've had lumps at other med spas, so I'm scared to try again. Is there a technique to avoid that?
Sure. Yeah, I mean, the product kind of flows in the path of least resistance. So I would kind of want to make sure there's not old product that might be already lumpy before we were to try to do a new session. So that again would be a personal assessment. But yeah, I mean, just kind of taking the proper attention and flow and then maybe massaging things out properly. And then sometimes it could be some things that we do after, like we don't want to be like biting, pressing, sucking on the lips because you can move it, mold it a little bit for the first couple weeks. So we kind of want to be very gentle with it at first.
Is there things that people should avoid so that way?
Like I said, the biting, sucking of the lips, kind of when you do that, when you put on your lip gloss,
Ooh,
that's something that you can kind of pull it to the inside.
what about a
Uh,
straw?
Yeah, I mean, gentle straw, that's okay. Just be very delicate with it for the first couple weeks until, like, if it's sore, leave it alone. That's kind of my general rule of thumb.
Mm-hmm.
A little on your sides that, you didn't want that, so that's why I'm kind of.
Oh.
Do whatever.
Two as we
Mhm.
okay.
Good.
That's a good question. Janelle had mentioned about, is there an option to purchase one vial of lip filler? It would be a syringe and either use it on other areas of the face or use half a syringe one time and the other half a year or so later.
So you purchase it by the vial. Not everybody wants a vial. Sometimes people need two vials, so it really kind of depends on the person. But certainly, like for her, if she doesn't want to finish this vial, maybe we can assess, popping up a little of these lines here, or maybe softening out these shadows under her chin. There's always a place we can find to put it. So
Yeah.
waste not, want not. As far as saving it for a year, I don't recommend that. Once you open the bottle or the vial, you kind of expose it to contamination. So saving it is really not a great option.
Yeah.
Well, we are kind of done. I do have some there, but I'd like for you to take a look and see what you think before we kind of go any further.
Pretty. I think that looks good.
You're okay with that? No more, no more, no more?
That was so fast. Look at that.
Yes, yeah.
All right, perfect. It looks like we have gone through all of our questions. Yeah, we have lots of fillers here, but again, we offer complimentary consultations. Please come in and see one of our providers to see what your other options are. And because of our amazing injectors, they may essentially recommend something completely different for you. So we want to make sure that we are seen by you. So these are our Instagram and TikTok, Yelp, and YouTube videos. On our YouTube, we have all of our webinars like this, all of our virtual events, so much education on there. We have a newest one with one of our patients that does facial balancing. So a single syringe, it can get to one area, maybe share in another area to hit little things, but patients will do anywhere between, 4, 5, 6 syringes in one sitting for a facial balancing. And that kind of brings me to this. This is an exclusive offer that we have for all of our attendees today. It's a buy more, save more on filler. You either get $100 off a single lip filler, or if you do 2, 3, 4, 5 syringes, you incrementally save. All the filler has to be done in a single appointment, which is very easy to do. If you go on to our YouTube, Jenny is one of the patients that we had to do a testimonial of a full facial balancing. You did see her pictures here as well. She did more than just this, but you can actually hear her story and her journey through it all. And it looks absolutely gorgeous. And thank you so much from both Shannon and I for having the time with us today. Please feel free to give us a call if you have any other questions. Please be on the lookout for our lucky attendee winner tomorrow on our social media. Thanks, everybody.